My name is Charles Alessi. I'm the Chief Clinical Officer of HIMSS, and I'm absolutely delighted to have an opportunity to have a conversation with Miquel Angel Garcia, who's the head of medical business for Olympus for Europe, the Middle East, and Africa. For our viewers today, could you give a sense of, tell us a little bit about your role and really about your organization as well?
Yeah, thank you. Yeah, my name is Miquel Angel Garcia. I'm leading, as you said, the medical business for Olympus. Olympus is a grown-up company, 100 years old, 100 years plus old, who has been lately going through a lot of changes in our portfolio. I'm pretty sure that many of you know our brand because we had been, during many years, one of the most important camera manufacturers in the world, consumer cameras manufacturers in the world. But in the healthcare sector, we have been inventors and developers of, as you were saying the other day, the scopy world, right? We were inventing endoscopes in the mid of the last century. And ever since, we have devoted our technology development into optodigital technologies that allow endoscopy to evolve and many other applications around optodigital technologies in healthcare. Lately, we have decided strategically that our future goes along with healthcare, and we have focused and concentrated all our resources basically in our healthcare technologies. Pleasure to share with you our thoughts about it.
Thank you, Miquel. And I have to admit, I was brought up with Olympus. I was brought up with bronchoscopies. I was an anesthesiologist when I was younger, and endoscopies and colonoscopies. And so really, I can see this is a grown-up business because I remember you being the leaders in the oscopy world in the 1970s and 1980s, certainly in the United Kingdom. Really, we're not operating in a vacuum here because, I mean, you talked about your organization maturing and looking to the next phase, but, you know, we're going through and really hopefully coming out of a pandemic because COVID has fundamentally transformed the business and digital modalities and interoperability are now at the center of an awful lot of what we do. And what I'd like to talk to you about is the next dimension, really. I want to move away from the oscopies, not because they're not important, of course they are, but really what you described is the next phase onto the continuum of care. And really with Olympus being much more involved in the patient journey. Could you describe that to me a little, and could you elaborate on that, please?
Thank you, Charles. Yes, indeed. The last 2 years have been a milestone in the life of many people, if not all of us, and that includes also the life of the companies. I think Olympus is no different to other leading global medtechs, where we were very much on focusing on developing and bringing technologies for the sake of the patient's health. And we understood in the last times that we do have a certain responsibility in the continuum of care creation. And it's not enough that medtechs are focusing on building and bringing the technology, but we do have the responsibility to ensure this continuum from diagnosis and early and diagnosis. We are very much committed with minimally invasive therapies, and also on the maintenance of the health after the treatment. And having that into the perspective, it changes the way that we look at our responsibility. You are right, Charles. We hold more than 70% market share of the endoscopic world, and that is a huge responsibility. 7 out of 10 endoscopies happening in any corner of the world are done with our equipment, and they are only one part of the whole continuum. So we are transitioning from product and technology developers to take care for a longer responsibility along that continuum. A lot of challenges happened and were shown during COVID and pandemic. And it showed that, especially in the hard lockdowns, the world at the hospitals was drastically changed.
Yeah.
And you could observe that in ORs, surgeons were not accompanied by students. They were not attending those ORs because the non-indispensable personnel were not allowed to be in the OR. But also proctorship was not allowed anymore because of the traveling. So surgeons were quite alone. And not to forget that the entire healthcare system and the industry of medtech, we are working together. And our people, our colleagues, are spending their life in GI suites or in the ORs. So the whole pandemic did not allow us also to support our customers and our healthcare professionals. So the first thing that happened then is we observe here is that the entire collaboration of the entire system has drastically changed, and then digital solutions were absolutely needed to go through those problems. Actually, we were accelerating the launch of a telecollaboration system called MedPresence that allow us training our people collaborating with the OR, the surgeons or endoscopies, having collaboration anywhere in the world, and even having educational systems that allow that education to happen in a high standard on medical, right? So the COVID impact has somehow been a catalyzer for digitalizing many things happening at the hospital. Moreover, as I was mentioning, we go then beyond the product, like allowing telecollaboration and taking care of this continuum of care. We are having our technologies and products along the journey. We are fundamental piece in early diagnosis of cancer, thanks to our endoscopes in urology, in gynecology, in endoscopy, in GI. But also we are very fundamental providers for therapies, both in the GI suites or in the ORs. And also after treatment, in the maintenance of health, we are fundamental piece for checking up the health of our patients with our endoscopies. But this continuum, we also try to take care. Documentation of all those processes are absolutely fundamental these days, and having systems that allow us to ensure a proper documentation, data, video, images, and that is available through the entire continuum. It is where we are focusing, and we're developing systems to support that.
And you're very wise to do that, Miquel. You're very wise to do that because, of course, health and care is changing really quite dramatically. We're moving into a world of precision medicine. We're moving into a world of AI, and you're in a wonderful place to exploit that. But you mentioned minimally invasive treatments. As we move into this world of precision health before somebody really gets diagnosed, and then precision medicine after somebody gets diagnosed, clearly one of the greatest advantages is the ability to do things earlier than otherwise one would do them. And you are in a perfect position to really be part of that journey, as well as this issue of telecollaboration and the MDTs, the fact that you're bringing clinicians together, citizens, patients, nurses, hospitals without walls. This is an enormous area which you're starting to actually get your interdigitate with the system that exists at the moment. So I think this is the start of the big journey for Olympus, as big a journey in my view as the journey you had when you became the big endoscopy people. And I was there for some of the beginning of that. And I think it's just as exciting, the journey you're on at the moment.
Definitely. And as I said, from Olympus, we experience and live this from a responsibility point of view. We realize how responsible we are to ensure that our technology is properly delivering the outcomes that it's been designed for. And there are so many roadblocks for the healthcare system to make the best out of technology.
Yeah.
And to evolve to a higher level. And,
yes,
and
yes.
we have to cooperate, both industry and system together, to bring us to the next step in healthcare, definitely.
You're absolutely right. But let me take you to the pandemic again, because the pandemic has demonstrated one thing really quite quickly. I remember in Italy when the pandemic really broke out in February of 2021.
20 already.
I've lost a year of my life. In February 20, one of the big issues was IT security. So, you know, we are now in such a digital world that these issues around cybersecurity and cyber hygiene have become everybody's business. They are the business not only of the medical manufacturer, not only of the medtech company, not only of the system, but also of the users themselves. And IT security is far more important than it was. How are you managing to manage your data?
Look, Charles, I don't know, I should say I like you asking me this, right? But it's so painful these days. You know why? Let me tell you something. IT security and malware is everywhere in the news. But yeah, it's a little bit, it's always there. But as we speak, and we made it public last week, we have been suffering ourselves in our own systems malware attack, ransomware attack. And then one can realize how dangerous that is for companies like ours. But the worst nightmare is not this. Our worst nightmare is that a patient cannot be treated in an acute moment because we are not able to deliver the devices which we are meant to deliver to that moment. That is our nightmare. Thankfully, we were able to manage this in a record time, and our hospitals and customers have not suffered from it.
So what can I tell you other than thank you for spending a little bit of time with me today. I look forward to meeting you in person, hopefully in Barcelona,
hopefully.
or in the place behind me in London. I think your journey is one which is going to be one of the more interesting to see over the next couple of years, as I feel really you're interdigitating with this new health and care system in every place you need to. I'm really delighted I have an opportunity to at least have a conversation with you.